Today we are going to see a clinical case. Let's start. A 7-year-old female presented to OPD with swollen red tender joint pain, which migrates from one joint to another joint. She also complains of a mobile lump with beneath her skin. On auscultation, we can hear murmur over the mitral valve area. So, ECG also shows a prolonged PR interval. On inquiry, patient has history of a sore throat past 3 weeks ago. So what is the most probable diagnosis? So here, when we think of such clinical case, we have to see the hints. So first, here is a pain, joint pain which migrates from one joint to another joint. So we can think of here migrating polyarthritis. So, and on auscultation we can hear murmur. So by murmur over the mitral valve area, we can think like that of, oh, it is the valvular damage. So when we think of these two clinical features, we suddenly can think of acute rheumatic fever, which is also a kind of autoimmune disorder. So other features we can directly match, that ECG shows prolonged PR interval and history of sore throat. That means history of streptococcal infections in past weeks. So diagnosis acute rheumatic fever. So causative agent is group A streptococcus, yani means Streptococcus pyogenes. What are the clinical features here? Migrating polyarthritis, valvular damage, which is the hallmark of this disease. PR interval prolonged, and this disease mainly occurs in the children from 6 to 14 years of age group. So, what is the pathogenesis? So, why does this disease occur? When a streptococcal infections occurs in a person in previously, so it can heal by itself, but after that, the people who had this infection, that people most commonly, they are most likely to develop acute rheumatic fever. So why? Because the M protein, which is the main virulence factor in streptococcal infection, it resembles with the antigens from heart and joints. So when body thinks like that, oh, it is the streptococcal infections, the M protein which are same as antigen from heart. So body's defense system attacks its own cells. It damages the heart, it damages the valves of heart, it damages the endocardium of the heart. In this way, the heart valve is damaged. The joints are also get swollen. So this is all about today's clinical case. Thank you.